but directed forward and down into the ear. So check the ear pieces before you put them in. The other important thing to remember is you must always clean with an antiseptic wipe. The earpieces, I'll start with the diaphragm and the bell first. They're probably less dirty. Clean those areas off, and then clean the earpieces off using another part of the antiseptic wipe before and after using them on your patient. Besides the stethoscope, we have another apparatus. This is called the sphygmomanometer. Awfully long word, sometimes shortened up by being called a manometer. And a manometer consists of a cuff, and this is the cuff portion of the sphygmomanometer, just this portion. And inside this cuff is a rubber tube, a rubber cuff that air goes in. It's much like a balloon, and it inflates around the individual's arm. These cuffs come in different sizes, and it's important to use the correct size because you will get an inaccurate reading if the cuff is too narrow or is too wide for the individual's arm. I have a couple of other cuffs here. This one you can see is much smaller. This is a pediatric size cuff and would be used for a small child. This one that I've shown you is considered an adult sized cuff. The other one is a very large cuff. This particular cuff can be placed around a very large individual, or sometimes if their arms, for whatever reason, cannot be used for blood pressure determination, this large cuff can be put around their thigh. That's quite an unusual situation, and if that were the case, you'll be directed by the nurse as to what to do about that. But the important part I want you to know is that you want to use the correct size cuff for the individual. The width of the cuff should cover 2/3 of the individual's upper arm, so that's a good way for you to know whether or not you've got the correct size or not. There are two tubes on the cuff. One of the tubes is connected to the pressure control bulb and the bladder inside, and that's this particular one. This is the pressure control valve. And the other tube is connected to this pressure gauge that you see. The bulb and the valve at the very bottom of this sphygmomanometer is used to pump air into the bladder of the cuff and control the release of air from the bladder. And I'm not talking urinary bladder, we're talking about the balloon or bladder that's within the cuff of the blood pressure cuff. The bulb can be held in either hand. It's usually most comfortable in your dominant hand. I happen to be right-handed, and so it works best for me to place it in my right hand. And the valve can be turned clockwise. If it's turned clockwise, then you are closing the valve. And when the valve is closed, then you can pump air into the balloon-shaped bladder of the sphygmomanometer cuff. By turning the valve counterclockwise, you release the air and the cuff will deflate. The pressure gauge is the last piece that's a part of the sphygmomanometer. This one is called an aneroid type. It has a circular dial, It can be handheld or held onto the cuff itself. Sometimes you will see the aneroid type mounted on a wall, and you would be using the pressure gauge from the wall. There's another type that you'll see there that's a mercury type of pressure gauge. It is a rectangular column. It's not used nearly as much as it used to be because of the possibility of this breaking and causing a mercury spill. And you may have remembered from previous discussions, mercury is a very toxic metal and can cause lots of problems not only to our environment but to individuals as well. There are other styles of gauges as well, but suffice it to say they all basically work the same way. They just may be in a little bit different shape. Each line on the gauge measures 2 millimeters of mercury. For placement of the cuff, the first thing you need to do is to locate the brachial artery at the elbow and note the pulse. And then place the cuff snugly and smoothly around the arm, about 1 to 1.5 inches above the elbow, with the arrows on the cuff pointing toward the brachial artery. If the cuff slides down the arm, it's been placed on too loosely and will give an inaccurate reading, so it needs to be put on again a little bit more snugly. The way to read the gauge is marked with a series of lines. The large lines are at increments of 10 millimeters of mercury pressure. There might be a number next to that longer line, or there just might be the line itself. The shorter lines represent 2 millimeters between each one, so it's 2 millimeter intervals. Behind me I have a relatively new type of blood pressure apparatus. This is called an electronic blood pressure apparatus. It has a digital readout. It's used now in more and more facilities. It's considered to be very accurate and takes some of the guesswork out of blood pressure determination. It does not require the use of a stethoscope. It does have a cuff that's placed around the individual's arm, and it registers the reading on the digital display. And if you have that type of electronic blood pressure machine in your facility, check with the nurse who can rather simply explain to you how it works. Some points to remember when obtaining blood pressure measurement. Either arm can be used, according to the American Heart Association, for blood pressure determination. However, if both arms are perfectly capable of being used, they recommend that the right arm be used.